let's start with macrolides. Okay, let's start. So macrolides, the most of the drugs ends with thromycin. Okay, thromycin. So it will be usually azithromycin, erythromycin, clarithromycin, roxithromycin. One exception is pyramycin. Okay, pyramycin where we have only mycin present here. Okay, so let's start. So macrolides, I have taught you this. This is erythromycin, azithromycin, roxithromycin, clarithromycin, pyramycin. So mechanism of action, this is same. This is the mRNA. So this is the ribosome, which is the 50 subunit and the 30 subunits. We have three steps. One, the tRNA comes and bind to the A site. This is A site and this is T site. So this is the acceptor site where a new incoming tRNA comes and binds to the A site according to the codon. Then this joining of amino acid takes place by peptidyl transferase. That is the second step. Third step, this whole of this moves this side. So translocation. So this whole thing shifts to this place. So this is translocation. So macrolides, it binds the 50 subunit and inhibits the translocation. This is the mechanism of action. Let's go to pharmacokinetics. So this is acid level. So it is given as entry-coated tablets. For erythromycin I'm talking about, it has short duration of action, about 6 hours. Food delays the absorption. It cannot cross the blood-brain barrier. It is partly metabolized, excreted in bile. So it is safe in renal failure. Okay. Now let's talk about the other drugs. Erythromycin, roxithromycin, clarithromycin and azithromycin. So erythromycin is natural. It is derived from Streptomyces erythraeus. So it is derived from Streptomyces erythraeus. So other three, roxithromycin, clarithromycin, azithromycin, all three are semi-synthetic. Relatively, it is short duration of action, which is 6 hours, but this is longer duration of action, which is about 12 hours. This is acid level. So since it is acid level, it is given as enteric-coated tablets. So all these three are acid stable. So now I'm not going to scare you. I'll just tell you. Wait, this is narrow spectrum. Okay, I'll say what erythromycin is going to act on. So in gram-positive cocci, it is going to, we have two species, Streptococcus and Staphylococcus. It is going to act on Streptococcus. So in gram-negative cocci, only we have two species, Neisseria and Moraxella. It is going to act on Neisseria. So I have said Neisseria, gram-negative Neisseria. Now in gram-positive. So in gram-positive, we'll remember as A, B, C, D, L, M. What are there? I'm saying, okay? A, B, C, D, L, and M. So A for actinomycetes, B for bacillus, C for clostridium, D for Corynebacterium diphtheria, L for listeria, M for mycobacterium. In this erythromycin is going to act on C, D, L, M, which is Clostridium, Corynebacterium diphtheria, Listeria, Mycobacterium. Here it is going to act on Mycobacterium TB. In gram-negative, we have a mnemonic sheep K, S for Shigella salmonella, H for Helicobacter pylori, Haemophilus influenza, E for Enterobacteriaceae, P for Proteus pseudomonas, K for Klebsiella. Okay, but here we have given all the atypical ones like Legionella, Chlamydia trachomatis, and Bordetella pertussis. So you don't have to write all this, just for your understanding. I've said this, so you can just write narrow spectrum. So roxithromycin is same as erythromycin. So this clarithromycin and azithromycin, it is going to act on, see, if you see, in this gram-negative is very less. Okay, so it is going to include those. So you can write it includes gram-negative bacilli also. So this both, what all it includes. So what it includes alone, you can try to write, that is Mycobacterium avium complex, Mycobacterium leprae, Toxoplasmosis gondii, and Haemophilus influenza. This four alone you try to remember and write. This you write as narrow spectrum. So this is enough. So now let's go for drug interaction. So this DX is drug interaction. So you can write DI, or else you might think diagnosis, so I'll change it as DI, okay? DI. So this erythromycin and clarithromycin is enzyme inhibitors, okay? Enzyme inhibitors. So since this is enzyme inhibitors, so it is going to inhibit the metabolism of other drugs. Since the metabolism of other drugs is inhibited, so it is going to stay in blood for a very long time. So we can say it potentiates the effect of other drugs. So that other drugs example is theophylline and warfarin. So let's go for uses. So uses, it can be the drug of choice or it can be the alternative. So for drug of choice, you will keep it as clap. Okay, clap. C for chlamydial infection. So clap C. So if you write 3, it is like C is up. C is written upside down. So you can write for C, 3 indications are there. One is chlamydial infection, chancroiditis, sexually transmitted disease, and then is diphtheria, Corynebacterium diphtheria. So here it is used for both prophylaxis and treatment. Okay, L for Legionella, A for atypical pneumonia caused by Mycobacterium avium complex, T for pertussis. So these are the uses for which it is used as a drug of choice. Next, alternative. In tetanus or antitoxin, tetanus toxide injection of all the things have been given. Next, for 10 days, we will give penicillin. So if penicillin is if penicillin is allergic, we'll give azithromycin. Okay, now we can give for streptomyces infection. So I'm sorry, I've said it wrongly. So for tetanus antitoxin, tetanus toxide, after giving that as therapeutic measure, we'll give azithromycin, no penicillin or not. For streptococcus infection, only penicillin is given. If it is allergic, we'll give azithromycin or erythromycin. In surgical procedure, we should not cause bacterial valve endocarditis. So beforehand, we are giving it. Okay, and one more indication is other uses like clarithromycin. Clarithromycin is given for H. pylori infection and leprosy. Okay, clarithromycin is H. pylori and leprosy. Azithromycin is useful for toxoplasmosis. Remember that azithromycin is given for toxoplasmosis. This you can remember as clap itself. In C is coming for clarithromycin. Clap A for leprosy, P for pylori, Helicobacter pylori. Clarithromycin is used for H. pylori and leprosy, or azithromycin for toxoplasmosis. Another is this macrolides is safer. Is safer in pregnancy. Only 3 antibiotics are safer in pregnancy. As of now, we have read one is penicillin, another is cephalosporin, another is macrolides. All 3 are safer in pregnancy. Now let's learn about the adverse effects. Adverse effect we'll remember with macro. In macrolides we have macro. We'll remember with that. So let's start. So if we see R for reversible, O for ototoxicity. It is going to cause reversible ototoxicity. Now let's start with M. So M, it is going to stimulate motilin receptors. So if it stimulates motilin receptors, diarrhea will be the side effect. So all GI side effects you can write. A for allergy, can cause allergy. Okay. C for cholestasis. In some patients, it causes cholestasis, especially that is erythromycin estolate. Erythromycin estolate. This causes cholestasis. Okay, specific. So it is not used in pregnancy and it causes reversible ototoxicity. Sometimes it can also be hepatotoxic. Sometimes hepatic injury. Okay, sometimes it causes hepatic injury. It is hepatotoxicity is higher in pregnancy. So it is not used in pregnancy alone. Okay, we have completed and one extra. I have talked about spiramycin, right? This spiramycin is usually given to Toxoplasma gondii infection. When it is mainly given for Toxoplasma gondii infection to prevent its transmission from mother to fetus. So that's all. We have completed macrolides in whole one page, and sure shot you can get all 5 points if you write all this. Thank you.